The warning is out. Nigeria is actually on the verge of a third wave of COVID-19. Well, this follows a spike in the number of confirmed cases in recent weeks. And of particular concern is that is related to, the newly discovered Delta variant in the country. Well, most likely, this is what is fueling the numbers that we're seeing. Well, it's back to you, Ndi and Ngozi in the studio.
Yes. We're always concerned about this third wave. All of the last 2-3 weeks, we've been hearing that it is really bad in Africa. And we kept on hoping against hope that it would not come to our shores. What are we, where exactly are we? What's this we're hearing about it already here? Well,
Lagos State Governor yesterday did release a statement actually implying that the third wave is already here, because if you look at the hospitalization, particularly in Lagos right now, it jumped in the last 2 to 3 weeks from 1% to about 6%, and it's growing. If you look at the number of confirmed cases, remember we had a conversation here and we talked about when the cases were less than 10, and I said it's not time for us to relax.
Well, it just
at a point, but right now we're seeing the numbers jump to the hundreds, even though just yesterday we had a reduction compared to what we've seen in the last few days. But it just tells us that there's something happening right now and everyone needs to be careful. So the third wave, which was ravaging Southern Africa and some parts of East Africa, is actually here. But if it's fueled by the Delta variant, that is still what the research will still do. But remember that sometime last week, we did get that information from the Nigerian Center for Disease Control that we have found one case of the Delta variant.
But Oyo State, before you run ahead, how deadly really is the Delta variant?
Okay, before we get to how deadly it is, I'm trying to build a story to actually make you understand that the Delta variant has even been here before we got that announcement last week. Because, by the way, I did a research and I found that for that case that was announced by the Nigerian Center for Disease Control last week, that case was from a woman who arrived into Nigeria and she's left since May. So, but seroprevalence surveys actually takes a while. But the question now is, how much did she move around before she left the country? It's still a question that, we're still begging answers for.
Between May and now, we're talking about 2 months.
Absolutely. And of course, Oyo State now, they say they found one case of the Delta variant as well. So you see, once you find it, remember when COVID first came into Nigeria, it starts from one state and before you know, it starts moving. So now we've seen 2 cases confirmed according to the government. So back to your question, India, as to how deadly it is. If you look at when the UK had that B171 variant of COVID-19, the level of transmission was actually put at 10%. Now, compare that to this particular Delta variant, that the transmissibility has been put at 225%. So that gives you an idea as to what we're dealing with. The minute you have one of this variant, there's a high chance that it would be able to get from one person having it, they might be able to transmit it to over 200 people. And so this is an issue.
That the symptoms are not necessarily the same as the original COVID-19, the coronavirus that we were contending with in the first place. So many people could be asymptomatic, but
the issues are still the same, be the symptoms or not. Nigeria will be fairly lucky in the sense that most of our cases have been, mild to moderate. With just a few handful of people had like severe cases where we've seen hospitalization and even the need for people to use oxygens or even the ventilators. We've been lucky in that aspect. But this particular variant is quite virulent, where we're seeing more hospitalization, using other countries as a case study now, not necessarily Nigeria, but it just tells us that, since this variant is here, more caution have to be taken. And of course, experts are saying that the Nigerian government have to sit up right now, since we can still contain it, since that we've only seen 2 confirmed cases of this particular variant, even though some will tell you that it's more than that.
That means multiply 2 by whatever.
You can't begin to operate in the realm of speculation.
Definitely.
If it's true, it's true. What they're telling you is more than that. Right. We're hearing states have run out of vaccines. What do you know about that? Particularly when I think about what you just read, that COVAX is getting more of the doses. That's good news if you think about this.
Yeah, well, COVAX is getting more doses. But before we come to COVAX, let's look at the fact that Nigeria, remember, would actually place the ban on those who had not received their first jabs, hoping that would get the second shipment of vaccines from the COVAX initiative by the first week of July. But here we are, second week going into the third, and there's no confirmed date as to when we will be expecting the next shipment. So as expected, a lot of states have now run out of vaccines because the government had removed that cap and said for those who had not received their first jabs, you can give to them because we're expecting new jabs. But one thing I do know for a fact is there's no need for panic for those who've received their first jab. They should go get their booster jabs, because I know that the federal government had taken some jabs and stored it up in case some states run out, and they would actually, augment the missing gaps. But coming to COVAX and the fact that, yes, we've now signed a new deal with China, where we're getting 12 their vaccine candidates, even though for now there's not a lot of data as to how effective they are. Even some countries will tell you that they would not accept the vaccines from China. But at the end of the day, COVAX says we need to get these vaccines into the arms of people, even though they are not as effective as the ones that have been approved in some countries.
Is it working for China? If it's working for China, why are they saying it's not effective?
It's not about who is saying if it's not effective or not. Remember, there's a process as to how you go about approving vaccines for emergency authorization, which is what we're seeing with all of these vaccines, by the way. But the last time the data came out from other countries who had received, especially the Sinopharm vaccine, it was put at 67% compared to other vaccines like the Moderna, the Pfizer, and even the AstraZeneca that, got up to 90% in their effectiveness.
Now,
but
it's not as great, but
we still need the vaccine.
Let's talk about need for booster shots and all of that. That's going on in the US now. Amaka will have to live
with
that.
Not just in the US, even Israel, they have.
Thank you very much. Yes, indeed. Well.